Welcome back to Dr. Stewart's in the Know. Today we are talking about ears. Yes, that dreaded, painful ear. Your little one probably has had that complaint, or you know someone else who's had the diagnosis of ear infection, also known as acute otitis media. So an ear infection means that there is pus and infection behind the middle ear, or in the middle ear, I should say, behind the eardrum. So as a physician, what I'm looking for is that eardrum bulging. If it is, then yes, I'm going to treat your son or daughter for an acute otitis media. Now the thing is, if your child's eardrum is red, that doesn't mean that it's infected. Many things cause an eardrum to be red, including viruses. But if your child's ear is bulging, there's a loss of normal eardrum landmarks, then yes, that is a true ear infection, and we know it should be treated with oral antibiotic. The recommendation is treating your child with a penicillin, like amoxicillin, or a second drug that's added, like amoxicillin with clavulanic acid, known as Augmentin. The only time that we would go to a cephalosporin like cefdinir or azithromycin is if your child had a true penicillin allergy. Having diarrhea or upset stomach with taking amoxicillin or another penicillin is not an allergy. So that's how we treat acute otitis media, and we treat it for 10 days. Studies have looked at shorter courses, and they're just not as effective. You have more treatment failure when you treat the ear infection with less than 10 days of antibiotic. The other thing that we are concerned about, or we often see in the summer months, is the outer ear infection, also known as swimmer's ear. Our kids are in the water all the time, they love to swim, and that's great. But how do we prevent swimmer's ear? Well, when they get out of the water, make sure you're drying their ears thoroughly. And there are also even over-the-counter ear drops that help with the drying process. If your kid is just prone to swimmer's ear, please consider investing in really good ear plugs for them. So that's ears. Let's stay safe, let's have fun, and stay in the know. Like us, subscribe to us, tell your friends about us, and keep coming back to get tidbits of good information that you can use to stay in the know to better take care of your little one.